Today, I'm going to take you on a very and deeply personal and professional journey that has not only transformed my life, has transformed my practice, has transformed the lives of my patients, and I believe can transform the status of our American healthcare system. It is a recipe for a healthier America that takes us beyond the old advice that an apple a day keeps the doctor away. I suggest we develop a better model that would make you want to be together with your doctor rather than away from him. The doctor of the future will give no medicine, but will instruct his or her patient in the care of the human frame, in diet, and in the cause and prevention of disease. Thomas Edison, over 110 years ago, issued that first prescription. And I'm sad to say that the American public and the medical profession itself has underutilized primary prevention. We're very good at secondary prevention. We can diagnose hypertension, diabetes, cancers, and then institute therapies, maybe to treat the symptoms or to prolong life. But we have not instituted the primary preventive measures that can actually prevent these chronic diseases. Can you imagine a date and time in this world where those chronic diseases are as rare as polio? No vaccine, no medication, no surgical procedure will do that alone. Therefore, we're going to take you through the venue of a culinary experience in which we're going to peel back the layers of an onion. For that peeling back is actually a metaphor for the dynamic process of self-learning, self-discovery. The American medical system has gone in the wrong direction. We clearly know that, and there are many consequences of it. The U.S. workforce, in terms of casualties, in terms of physicians specifically, by 2025, there will be a physician shortage in this country of over 200,000 physicians, primarily in the primary care specialties of family practice, internal medicine, and pediatrics. 43% of physicians are considering leaving their practice in the next 5 years. And morale is at the lowest at all time. Take you back to 2007. I was one of those burned out and discouraged physicians. I was overweight, I was unhealthy, I was sedentary, and I was so stressed out that I thought that the only way that I could get out of this particular dilemma was to leave medicine and become a chef. You might say, well, why become a chef? Well, just think about it. Look how happy I am on that screen. You know, making good food that's tasty and delicious and sharing it with loved ones and having them appreciate that, that to me was an awesome feeling. And so I had to pull back the onion a little bit further and actually look at the roots of my own discontent. And part of it was a lack of knowledge, especially in the scientific disciplines that would help me prevent disease, specifically one of them being nutrition. A 2009 nutrition study came out and said the average medical student in this country receives only 19.6 hours of contact hours in nutrition. That's appalling. Furthermore, despite wanting to be the Marcus Welby physician that I had always idolized growing up, I found the same discontent and discouragement in my patients. They were unsatisfied. They were unsatisfied because they were not making progress in their own personal recovery and improving their health. And so, and you've all heard it, the ending of a visit would typically be the same rote sentences over and over again to hundreds of patients, hundreds of visits, hundreds of times, and you can repeat it after me because you've all heard it. You need to eat better, you need to lose weight, and you need to exercise more. And, as I'm feverishly writing everything down and getting everything ready for the patient process, I'm gently walking out the door and saying to the patient, oh, guess what? I'll see you in 6 months. When studies look at that interaction, the time that a physician can spend interacting with a patient in a significant degree to cause behavioral change to improve their lives is limited to 7 minutes in an office visit. We spend more time boiling eggs than educating patients. We need to change this. Can you imagine a different system where this could change? And the default mechanism is pretty easy. I don't have time to explain things. I don't have time to do things with the patient. Write a prescription. Write a prescription for every ill. And such we have our system. Now, I have nothing against prescription medications. They have their role in treating patients. But primary prevention asks us and demands of us that we get at the root problems of why people are unhealthy. And in practicing, treating patients with these medications, I became extremely frustrated because I saw people dying of the same diseases that I was trying to treat. 4 years of undergraduate college, graduating summa cum laude from Loyola University, 4 years of medical school, 3 years of residency, accolades for being a medical educator, and then 20 years of practice where I had the confidence and respect of all of my patients. I was ready to give that up. I was ready to give that up because something was grating at my soul. And people around me, especially my medical colleagues, in fact, my senior partner would look at me and shake his head and say, "You're crazy. You're absolutely crazy." You see this crazy man on the screen? It was a Greek philosopher, Diogenes, who went around the Greek countryside during the daytime, mind you, with a lantern. He was like, "What are you walking around in the daytime with a lantern for?" He said, "I am seeking truth." I was on that same journey because I wanted to find the truth about how to really practice medicine. And so it took me further to the east, to one of my favorite all-time experts in understanding the human condition, Karnak the Magnificent. He told me I knew a man who gave up smoking, drinking, sex, and rich food, and he was healthy right up until the day he killed himself. I'm like, whoa. But Karnak taught me something even more, because now I have the powers of divination. Are you ready? Diet, denial, and deprivation. What are the 3 best methods to ensure failure at changing people's behaviors and lifestyle? And so I knew it had to be something more. And that experience happened in 2008 when I was fortunate enough on my journey to actually become a chef to go to the Culinary Institute of America in Napa Valley, California, and meet the teacher of my dreams, Dr. David Eisenberg from Harvard University, who's actually organized a course called Healthy Kitchens, Healthy Lives. That course marries medicine and the culinary world. Could you have asked for a better path? Could you have asked for a better answer to prayer? And in that experience, I came away with such a fire in my belly that I knew that I was going to do something special with this. Not only improving my life, but now suddenly improving the lives of my patients. Teach me and I remember, tell me and I forget, but involve me and I learn. And I knew that I had to start involving patients in this process, or they would never learn how to take care of themselves. For instance, we know that the science of medicine now is saying that food is nutrition, food is medicine, to the point that we understand it affects our genes. Same thing with exercise. We know that when we move, when we contract a muscle back and forth, we send signals to our DNA, that chromosome in our cell, which actually can generate a receptor that brings blood sugar or glucose into the cell, independent of insulin. Important point, independent of insulin. Exercise is medicine. And finally, from the traditions of yoga, meditation, qigong, we know that this meditative work can actually affect parts on our chromosomes that determine how long we live. What beautiful things to now be offering my patients. You all recognize this, correct? How many of you think that you can learn to eat better, move more, and become less stressful in that room? It isn't going to happen. So I had to find a better model. And that model was going back to the Greco-Roman tradition of the naked gymnasium, or gym, where people not only came to get physically active, but they would connect on social, moral, and intellectual levels. And I said, wow, what a novel concept. Could I create this? And so, in 2010, with an innovative building owner and a creative genius behind Wellbeing MD, Ryan Gerber, and Mike Coogan was the building owner, we literally stripped the walls down in my office to create such a center of life that would foster all of these processes. And there it is, the first teaching kitchen within a physician's office in America. And let me tell you, dreams nourish reality. See, I finally got back to what I really wanted to do. Doctor. Doctor means in Latin, teacher. And to educate, educare, means to draw out of, not to keep pushing into people. And I found this secret in the nidus of this healthy kitchen. We begin with simple food that's appealing to the eye. We give patients the ability to learn skills to prepare their own food prescriptions. And the dishes they create are absolutely amazing, filled with taste and color and nutrition. And remember that flavor trumps nutrition, and the other corollary is you eat with your eyes before you eat with your mouth. So if it looks good, it's going to taste good. And this American sort of comfort food, people know what it is? It's actually sloppy lentils. Okay, not a sloppy Joe, it's a cousin. And the most important part of all this is the dynamic of getting people around a table, sharing a meal, sharing ideas, sharing life. We have sadly got so far from that in American culture that this is the revival. We make movement medicine. We do it together. We actually make it fun by putting the we in wellness, and every patient that comes through our center actually can develop their own prescription for functional fitness. Now you might ask yourselves, well, that's nice, Dr. Principe, this is all well and good. Does it work? Well, with over 500 graduates gone through our program, I wanted to bring you a snapshot of one of their responses. The roadmap to wellness changed my life, giving me the tools I needed to overcome the unhealthy habits that I have developed over my short lifetime. I started the program as a 45-year-old man, overweight, out of shape and looking for help. Since starting, I have lost 65 pounds, was taken off my medications for high blood pressure, acid reflux, and most importantly, ladies and gentlemen, I improved my life and I improved the life of my family. There is no prescription medication that can provide those things to patients. The secrets are this: 3. 1, adults tend to learn better in social groups. The dynamic of creating wellness, the chemistry of wellness, moves through a room with, instead of that 7-minute egg timer, 2 hours with moi. And finally, here's the other great benefit. Insurance companies are waking up and knowing that this model works and are reimbursing physicians for this process. But we must be careful, because there are many things that masquerade as wellness, whether they be a diet, a new treatment, a procedure, some fad nutrient. If it doesn't get at the primary root cause of what's causing the illness, it will not be effective. Thus, it will require a revolution in thought and a renaissance of good motives to bring about the new medicine necessary for true well-being. You all have a choice today. Do you want a healthcare system that actually takes you beyond the apple, that gives you self-determination and control? Or do you want this old model in which you got a pill for every ill? Mark Twain said it best: we have 2 days that are most important in our life. The day that we're born and the day we figure out why we were born. This is an exercise in gratitude, and it takes the head and it connects it to the heart. I would not be standing before you without a loving, caring family, a dedicated multidisciplinary team that helps me every day provide this type of care, and a rising group of well-minded people across this nation who believe in this concept. It has allowed me to peel back the onion, to go beyond the apple a day, and to become what Thomas Edison predicted, the doctor of the future. America, the recipe is here for improved health care. I would like you to taste it, savor it. Let us not wait 110 years to make this happen. Thank you very much.